The lap band or gastric band is a device to help patients lose weight. But how does it work, and what kinds of results or issues can you expect? Hi, I'm Dr. Brian Young, a naturopathic doctor in Toronto. We'll be talking about weight loss surgeries on this channel, so subscribe if you're interested in learning more. Full disclosure, I'm not a surgeon, so I'm not an expert on the actual procedure. Rather, I've helped to support patients who've had a lap band done by assisting in their post-surgical recovery and long-term weight loss. From the experiences of these patients, I'm here to talk to you about what you might expect if you decide to get lap band surgery. The laparoscopic adjustable band, also known as the lap band or simply gastric band, is a surgical procedure in which an adjustable band is placed around the top of your stomach. The hollow band is connected to a tube and external port, which allows water to be pumped into or sucked out of the band, thereby tightening and loosening the band as needed. It works by creating a small pouch at the top of your stomach by squeezing the area right below it. This compresses any food that you eat near the top of your stomach, triggering your stomach to release fullness signals and tricking your body into believing your stomach is fuller than it actually is. The idea is that you'll feel fuller on much less food and eat less, leading to weight loss. The procedure. The insertion procedure is around 1 to 2 hours, and you'll be under general anesthesia. It's done via laparoscopy, so they make a few small incisions in your abdomen and thread all the equipment and tools through those small holes. Most patients are able to return home the same day after surgery. Your band will be empty at first to allow your stomach to heal and get used to the band. After several weeks of recovery, you'll have your first fill. So this is where your surgeon will begin to fill the band with saline. Additional fills and adjustments to the volume of the liquid in your band will be made depending on your progress. For example, if your weight loss stalls and your appetite begins to increase again, you might have to have your band tightened a little. Or if you experience too much nausea and vomiting after your fill, you might have your band loosened slightly. Side effects and complications. There are a lot of common side effects that you might experience after each new fill. Heartburn, nausea, and vomiting are very common, so you might need to switch to a liquid-only diet or use any heartburn medication your surgeon prescribes for a few days, as your stomach gets used to the new size. If the symptoms get worse or don't go away, or you develop new symptoms like being unable to swallow food properly, you may need to go back to your surgeon to have your band adjusted or loosened. Heartburn and reflux may also become a consistent issue, as well as excessive burping and belching. If you eat too quickly, you could also end up with nausea and vomiting. You'll need to eat slowly and carefully, chew thoroughly, and take small bites and portion sizes to minimize these risks. Some other more serious potential complications of gastric bands include the band slipping out of position, the tube separating from the band, ulcerations, and infections, so you'll need to make sure you follow up with your surgeon as needed. A gastric band may not be appropriate for some patients with pre-existing inflammatory stomach issues. Your surgeon should also screen you for those. Is it reversible? The gastric band is technically reversible, although it can stay in the body for many years. It's touted as reversible, kind of like the gastric balloon, and can be removed without permanent alterations to your stomach. However, in reality, bands that have been on the stomach for too long can potentially change the shape of your stomach and generate permanent scar tissue around where the band restricts the stomach. This results in more complicated gastric band removals, which could result in further damage to your stomach. So gastric bands can definitely cause irreversible damage, especially the longer you've had it in. These permanent alterations can also potentially complicate or reduce the effectiveness of gastric weight loss surgeries you might get in the future, like a gastric sleeve or bypass. Is it effective? Initial weight loss is not too difficult, and most patients are able to lose around 5 to 10% of their current weight without doing too much. However, weight stalling and rebound is common in patients who don't build good dietary and lifestyle habits long term. Don't get me wrong, gastric bands can be quite effective, and the total amounts of weight lost over time can be substantial, with a few of my patients losing well over 100 pounds over a few years. However, not everyone experiences such success, particularly patients who have poor external support outside of their gastric band surgery. It's important that patients follow up with a clinician to monitor their weight loss, as well as follow up with their surgeon to determine whether gastric band adjustments are necessary. With proper dietary and lifestyle interventions, as well as proper gastric band adjustments, weight loss can be sustained. Gastric band removal. Something you need to think about before considering a gastric band is when and how you might have your band removed. Some clinics that install gastric bands do not include the removal cost in their fee, nor schedule a particular time for your gastric band to be removed. Because gastric bands cannot stay in your body forever and eventually need to be removed, if the clinic that installs your gastric band goes out of business and you don't have an alternative way to have it removed, you could find yourself stuck with your gastric band for longer than you anticipated. Also, gastric band removal can be complicated depending on how long you've had it in, and how much scar tissue has formed around the band. In rare cases, the removal could end up costing as much as the actual installation. Finally, gastric band removal commonly results in weight regain. It's common for patients to undergo what we call revision surgery. That is the removal of the band and transition into another bariatric surgery like gastric sleeve or bypass, usually because the band stopped helping them to lose weight. In a number of these cases, I've had patients tell me they wish they'd just gone directly to the gastric sleeve or bypass to begin with. What to expect? Overall, gastric bands are a tool used to help patients lose weight. It has received some criticism over the past few years as clinicians debate whether the potential risks and limited effectiveness compared to other weight loss surgeries make it worth it. Nevertheless, if you do decide to get a gastric band, keep in mind these few things. 1. It's very possible for gastric bands to leave lasting changes on your stomach, from lifelong heartburn issues to permanent scar tissue around the stomach. Although the band may be gone, the damage it leaves may last for quite a while, and this might negatively impact your ability to get other weight loss surgeries on your stomach in the future. 2. The cost of having a gastric band inserted is quite high, around $15,000 to $20,000 for the insertion alone. This does not include the cost to remove your band, which can run anywhere from $4,000 to well over $10,000. So you're looking at $20,000 to $30,000 total or more if you're transitioning to a gastric sleeve or a bypass once your band needs to come out. So if you're thinking about trying the gastric band first and are considering a gastric sleeve or bypass in the future, you might want to consider just starting with the sleeve or bypass and skipping the band altogether. And 3, make sure you have a good support system in place if you do get a gastric band put in. The support should include a clinician to support any dietary and lifestyle interventions, as well as continued follow-ups with the clinic that installed your band to make sure you get proper band adjustments as needed. If you're interested in the type of weight loss protocol we use for supporting our patients on gastric bands, check out our online weight loss program in the description down below. The idea of a gastric band effortlessly helping patients to lose weight and simply being removed without any trace once the desired weight is achieved is a little too optimistic in my opinion. Regardless, it's entirely up to you and your physician to decide whether or not to try a gastric band. Let me know in the comments down below if you've had experiences with a lap band or gastric band, and if you found this video helpful, please leave me a like. As before, I'm Dr. Brian Young, bringing you weight loss info on this channel. Subscribe and hit the notification bell if you're interested in learning more, and share it with someone you know can use the help.